How come we're number one? Because we're Inspiration FM.
Did you know that environmental hygiene is key to maintaining health and well-being in both public and private spaces? Join us on the Drasa Radio Half-Hour Show every Wednesday from 11:30 a.m. to 12 noon on Inspiration 92.3 FM Lagos for tips on effective hygiene and sanitation practices to help create safer, healthier environments. Don't miss it.
It is for your number one family radio, Inspiration 92.3 FM. This is still the tea break, and it is time for Drasa Radio Show. Welcome. Now, for those who don't know what's going on, Drasa Half Hour is a public health awareness program that has been featured on Inspiration 92.3 FM since last year in 2023. And this program airs every Wednesday from 11:30 to 12. And this edition is to raise public awareness about effective hygiene practices that we can all do, whether we're at home or at school or even at our workplaces, just to reduce the spread of preventable infectious diseases around us. We all have a part to play in reducing this spread. Now, DRHH stands for Dr. Ameyo Stella Adadevoh, the courageous doctor who identified the first Ebola patient in Nigeria in 2014, but she later died after contracting the infection from the patient. Now, her actions saved the lives of millions of Nigerians, and as a non-profit public health organization, the Drasa Health Trust has, since its establishment in 2015, continued her legacy of protecting the health of Nigerians. They're constantly working to develop health champions like you and myself who can identify, prevent infectious diseases and influence those around them to stay healthy. Today we have two members of the Drasa team in the studio with us, and they have come with prizes. You know what, that when Drasa comes on the radio, of course they are here with prizes, and you know you don't want to miss out on this one. So stay tuned for a chance to win. And like we always say, the expo is in listening, because there's going to be a quiz section after. So just pay attention. If you pay attention, you would win yourself a prize. Our first guest today is none other than Mr. Christopher Aliu, who is a program manager at Drasa Health Trust. Good morning, Mr. Christopher.
Good morning.
Welcome. Also in the studio, our second guest is Moyosore Odumesi, aka Lady Mo. She's a project associate at Drasa Health Trust, and welcome to the show, Lady Mo. Moyo.
Thank you.
It's great to have both of you with us today. So, Chris, tell us, what do we do to ensure good hygiene at work? Today we're talking about work. So how do we ensure good hygiene at work?
Yeah, I mean, it's another exciting time to be in the studio again. Like you rightly mentioned, the last few weeks we've spoken about the hygiene practices that parents can teach their children at home. And then we've also spoken about the effect of open defecation on the environment, right? So we'll be looking at hygiene in the workplace. And when we say hygiene in the workplace, we are looking at those things that organizations, companies need to put in place to ensure that, you know, there's a healthy work environment for people to be able to work and not fall sick. And I know some might be wondering, do people fall sick at work? But the reality is true.
Because
right?
there's lots of people in one space.
Exactly.
Sharing the same things and things like
you
that.
know. So, just imagine the scenario, somebody, one of your, I mean, you go to work and a colleague of yours is having maybe a flu or a cough. And then as much as he tries to stay away, at some point the colleague maybe tries to request assistance from you, and in the process just mistakenly, cough. The chances of you catching that cough the chances are very high. So that is why the work environment needs to ensure that some things are in place to ensure a healthy work environment for all staff. And when we talk about work environment, we're not just talking about people that work in corporate environments, people that work in, your local stores around. So, the malls and all of that. So, one of the first things that we want to look at today is the fact that organizations need to promote a wellness culture. When we talk about wellness culture, what do we mean? We mean culture in the workplace that encourages employees to, practice healthy lifestyle. Lifestyles that, allows them to stay healthy, to work, and not fall sick every now and then. So that's what we mean by promoting a wellness culture within an organization. So I'll give example of some of those. For instance, in some organization, we know how the work environment is like. You can take a 10 minutes walk. You can make it a matter of policy that when people have sat down on their desk, maybe for 2 hours or more, sometimes we have long meetings. So they can take a 10 minutes break to walk around. Yeah. Right? That's one. You can also encourage adequate intake of water. We need water to help our system to, fully functional, to regulate and regenerate the cells in our body. And if people are going to take regular water when they need it, it means that the workplace or the organization must provide for clean, drinkable water for the staff. And how we can implement, some of these practices in the workplace. Organizations can, conduct seminars, occasionally organize, team session about health where employees get to, learn about what practices they can, practice. We can look at, during those seminars, we can look at stress management, we can look at nutrition, we can look at, discuss the importance of physical activities. So those are three things that we can look at. And it gives employees opportunity to share their experiences, ask questions that they have, and, they get the answers they need to be able to practice healthy lifestyle within the work environment. So another measure that we can put in place is to encourage employees to use their leave days. Some of us have the habit of, trying to delay. Yes, workaholics, and then some of us want to delay our leave so that we can take all of them at once. And it gets to a point that you don't ever get.
Is that very bad though? Is that a bad thing?
Well,
maybe not entirely.
Yeah.
But by the time you're working so much, you might get burnt out. Yeah. Before you now eventually take the leave, because of course we are juggling work, family life, personal life, so many things at the same time. So sometimes you need those breaks to just pull away, plug out, and just relax. But if you now wait that you want to walk all the walk before you now finally take the leave, you might just break down.
Yes, that's it basically. Sometimes all the leave that you've been piling up, you don't eventually get to take all of them because of the demands of your work.
Because maybe the time never comes at the end of the day. Time that you want to take the leave.
Exactly. So we want to encourage workplaces to ensure that you give people, ensure that they take their leave, they take time to rest, to recharge, and they come back refreshed, energized, and motivated to even deliver more. Let's not forget that a healthy workforce is a productive workforce. So we must ensure that we put those measures in place.
Right, so in case you're just joining us, we're still live with our guests from Dr. Ameyo Stella Adadevoh, Drasa Health Trust, Christopher and Moyo, who have been enlightening us about the role of HRs in keeping the workplace healthy and safe. And of course, we'll also open the phone lines for you to answer some quiz questions so you can win the hygiene kit. And I hope you've been listening. It's been an interesting conversation so far. And of course, if you have any questions, please do send to the WhatsApp line 0817-313-6193. All right, Moyo, let's hear from you.
Yes, thank you. So we've been discussing different measures that organizations can put in place to just ensure or to help maintain a healthy lifestyle for their employees, because just like he said, at the end of the day, healthy employees, productive company at the end of the day. So what we can do, another measure we can do to to encourage or promote hygiene practices in the workplace. So for example, organization can ensure that they are cleaning staff, give them proper orientation, and there's monitoring to ensure that they clean properly. So cleaning is not just about sweeping the office and mopping, that they clean and disinfect high touch areas. And what I mean by high touch areas are areas that are frequently touched, like the tables, the door handles, the restrooms, the railings, the windows, even the light switches. That people, those are things that surfaces that we share. Everybody touches it. Photocopying machines in the office, printers, and all of that. So they should ensure that they clean all those places, the lunchroom, the staff lunchroom, and all of that. That they are well cleaned and well disinfected. Because you come to a place like let's say for the restroom, and you just see so dirty, and you be like, no, they've cleaned it this morning. So we need to pay attention. It's not just enough to employ cleaning staff. We have to monitor them and give them the proper orientation about what they should do. And this does not just apply to offices and corporate organizations. Even you that is that has a local shop, malls, you clean either you are doing the cleaning yourself or you have cleaning staff. Like just make sure you do this thing, clean your shelves and all of, because at the end of the day, dust will gather, and we've talked about it, that germs are everywhere.
Yes,
and we can pick them from everywhere. Yes, another thing we can do is to make sure that hand hygiene resources or materials like our hand sanitizers, our liquid hand wash, they are present in places like the restrooms, the breakout rooms, because I've gone to let's say organizations where I've gone to use the restroom and the hand wash is nowhere to be found. And somebody goes to use your employee goes to use the restroom and they come out, they can't wash their hands, and they will shake another employee and transfer germs. We've discussed these things. We've talked about these things. By providing all these things, by ensuring all these things are in place, like the hand sanitizers, the hand wash, and proper cleaning, would reduce the spread of infection and infectious diseases within our work environment. So now we've talked about workplace hygiene. We've talked about physical health, but there's this mental health too, because at the end of the day, like I said earlier, we're juggling so many things, and it takes a toll on the mental health, which is very, very important. What another thing that organizations can do is consider adopting what we call employee assistance programs, EAPs for short. They are just like work-based programs that are free, and they offer like some form of counseling, short-term counseling for in case employees that are struggling with burnout, stress. Because when we talk about mental health, it's not just about somebody that has depression or all these psychotic disorders, because somebody can just be burnt out, and it's a mental health issue because of so many things that they are going through at work, the workload, the family demands and all of that. So they will need this this counseling programs to just assist them and guide them through that process, where they will get adequate let's say resources to get back on their feet and be productive again. So it's good to provide this, adopt these EAPs that we call them employee assistance programs, where they'll get counseling and all of that, and they can talk everything out with that counselor. Because at the end of the day, mental health also has effects on the physical health.
It does.
By the time you're mentally stressed, it affects your immune system. You're falling sick all the time, and taking sick leave. So HRs, if a way to reduce people taking recurrent sick leaves, just provide this wellness programs like this for your employees. You just check in. In fact, you can just make it a system that after 3 months on the job, you have this, just talk it out with the counselor, talk about things. It doesn't have to be, the person is not mad, you're just talking and pouring everything out and all of that. So these are programs that a whole approach to health that can reduce employee absence from work and increase productivity at the same time.
0817-313-6193. That's the number to send your questions to if you have any questions for our guests in the studio from Drasa Health Trust. We've been discussing workplace hygiene. Yes, we've spoken about the home, the hospital. Today we're talking about workplace hygiene and the role that HR has to play in ensuring that there is workplace hygiene. And also they've come with prizes. We're going to get into the quiz section shortly, so make sure you are tuned in. Get your phones ready to call in and answer questions so that you can win yourself a prize. All right, going back into the conversation, Chris.
Okay, so I'll be speaking again about, just about rounding up now before the callers will jump in on the conversation. One other thing that we can do in our workplaces is to implement a comprehensive health benefit program for employees, right? Companies that have a complete welfare package, health welfare package for staffs, something like paid time off, where they can take sick leave, they have health insurance, they are more likely to have better prepared staff, productive staff. So those things are very important. When they need health services, they can get them, without thinking of how much they're going to spend from their salaries, without thinking they're going to lose their salaries. We have circumstances where people have to borrow money ahead of, take an advance from their salary to take care of their health before the month even ends. And by the time the month comes to an end, what are they going back home with? So when you have employees that they know that when they need these health services, they can get them, it energizes them, it motivates them to even be more productive. So it's very important that we we have all of this in place, those health benefits, a comprehensive plan, not just think that because they have health insurance is enough.
Yeah.
I mean, when they take leave off, when they take paid time off, it's another opportunity for them to relax and really engage in things that are not so formal activities like they do in the office. It has happened to me when I think I remember for the first time I went at the end of the year when we closed for the year, and I didn't open my laptop for complete 2 weeks. It has never happened before, but I found that very, 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 refreshing. Yes, it was an experience that I really enjoyed, and
a memorable one.
Yes,
I did not open my laptop for 2 weeks.
For 2 weeks, it has never happened before. So, and it was something lovely and something I look forward to doing again. So, secondly, we also have, life insurance, right? I mean, when we talk about workplace hygiene, I mean, it's all of those things. We're talking about things that create an environment where employees can thrive, where their well-being is well taken care of. So life insurance, we don't pray that people fall sick, but death is inevitable. At some point we're going to leave the face of this earth. So death insurance, when we talk about life insurance, it's a contract between an insurer, which is the company, and an insurance company, where they get to pay a certain amount of money that we call premium, and at a timed interval, maybe every year or something. So, and then if the eventuality happens that an employee dies, the beneficiary of that employee gets the full benefits.
The next of kin.
Yeah, exactly. Like to use in Nigeria, get the full benefits, and it can help them to, navigate some challenges at that moment in their lives. So, it's important that we also have this health insurance in place for employees. So, yes, I think I want to wrap up on that.
All right. We have a message here from Kemi at Yaba. She says, "Good afternoon, dear guests. My question is, what are the hygiene implications of eating at one's desk while trying to ensure optimal work and efficiency? Like just eating at your workstation."
Okay. Where would you like to speak to that?
Okay,
Hygiene
maybe because
implication.
I'm guilty of this. I might be a little biased. I would say that it's not like there's a really negative, like if you observe, like you wash your hands before you eat, like for example, you clean your utensils, like the spoon that you want to use to eat properly before you eat. Apart from the fact that it's not so healthy, like walking and eating, you don't get to, you might have some digestion problems, like apart from all those kind of things, there's no really like negative hygiene implication to that actually. But it's just that if your cleaners are doing their work properly and your desk area is clean, exactly, that's another thing. But if you know that maybe this your desk is not a very trusting environment, it's not an environment that you really trust, as long as it's not dirty, you're observing the moment of hand hygiene, that's washing your hand before you eat and all of that, I think you're good to go.
All right.
But although don't be so much of a workaholic. That time you take out to eat would help you plug out from work.
I think that's what we mentioned earlier, taking that time, if it's 10-15 minutes, and then so you move away from your desk. And of course, that also links us to the idea of disinfection. I mean, your desk, is it properly disinfected before you now just drop anything there and pick it up to eat?
All right, thank you, Chris and Moyo, for the information given to us on workplace hygiene and the role HR and employees can play in maintaining good health. Now, if you're just joining us, you're welcome to the Drasa Half Hour Show. Our guests are from Dr. Ameyo Stella Adadevoh, Drasa Health Trust, and they're here to educate us on workplace hygiene, and to top it all, they are here to give away prizes for those who have been listening. So if you have any questions, you can also send them, just like Kemi did. Send us a question to our WhatsApp platform 0817-313-6193. We'll take a short break, and when we come back, we'll dive right into the quiz section. Don't go anywhere.
That environmental hygiene is key to maintaining health and well-being in both public and private spaces? Join us on the Drasa Radio Half Hour Show every Wednesday from 11:30 a.m. to 12 noon on Inspiration 92.3 FM Lagos for tips on effective hygiene and sanitation practices to help create safer, healthier environments. Don't miss it.
All right, it is still your number one family radio, Inspiration 92.3 FM. This is still just a half hour show, and it's time for us to head over into the quiz session. We have 8 questions. You can call in to answer one of the questions. Please note that if any question is answered wrong, we just have to pick another one. And once we have, we're gunning for 5 winners. Once 5 is our maximum, right? Yeah. So if once we get 5 winners, we'll cut it off and we'll end the question section. So any caller after the 5 winners, you have to tune in next week for another chance. So call us now, 0700 923 923 923. 0700 923 923 923 is the number to call, or you can also call us on 0916 067 2362. That is 0916 067 2362. Hello. Please do try and call us back. 0700 923 923 923 is the number to call. 0700 923 923 923. Or if you're not able to get us on that number, you can also try 0916 067 2362. That is 0916 067 2362. You are calling to answer a question correctly to win yourself the Drasa hygiene kit. And I know that what is inside that kit, my God.
It's a whole package.
Hello.
Hello,
Good morning. Hello. You not disinfect your phone. Hello.
Oh my God.
Hello, good morning.
Hello, good morning.
Good morning. Welcome to the show. What's your name and where are you calling from?
Sir,
Sir?
I'm on the road. I'm calling now.
Yeah, what's your name?
My name is Joseph. Adadevoh Joseph.
Adadevoh Joseph from the road. Joseph, are you ready for your question?
Yes, I am.
All right.
Okay. Hi, Joseph. Can you mention 2 hygiene practices to? Oh my.
Village people.
Joseph.
It's actually village people. That one is like, hello. Hello, good morning.
Hello, good morning.
Good morning. Welcome to the show. What's your name and where are you calling us from?
My name is Divine. I'm calling from Lekki.
Divine from Lekki. All right, Divine, are you ready for your question?
Sorry, I can't hear you.
I said, are you ready for your question?
Yes, I'm ready.
All right.
Okay, hi Divine. Can you mention 2 hygiene practices to put in place in a work environment?
Hello?
Yes, can you hear me, Divine? Hello?
Hello?
No, I'm sorry, Divine. Please try and call us back. We'd have to let you go. Hello, good morning. Hello? What is going on? We have someone saying, I want to answer question too. I want to answer quiz too on the WhatsApp platform. Is there a provision for that? Do you want to give the person a question?
I don't know how.
I mean, if the person has been listening, you can.
Yes, I think the person should call.
You can ask it. Well, I mean, Kemi, you can also call 0700 923 923 923 or call us on 0916 067 2362. That is 0916 067 2362. These are the numbers to call for an opportunity to win yourself a Drasa hygiene kit. Is very, 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 very important. Let's see if this will be our first winner. Hello, good morning.
Hello, good morning.
Good morning. What's your name?
Yeah, my name is Ruth from Oshodi.
Ruth from Oshodi. All right, Ruth, are you ready for your question?
Yes.
All right.
Okay, Ruth.
I'm ready for your question. I've been listening to it all the day, but today my network was so bad. I couldn't listen. I couldn't get it, but I just get it. So I asked me any question.
Okay, Ruth. Ruth, can you mention 2 hygiene practices to put in place in your work environment?
Yes. Washing of hand, regular washing of hands before eating. Then each other hygiene. Then always make sure you practice when you want to sneeze, you sneeze to your elbow. Before you eat, you wash your hands. Then you cut your fingers. All those things.
Yeah, you see, yeah.
That's not quite.
Yeah. What can we put in place to encourage people to do all of those things that you've just mentioned?
Hello?
No, that's
Hello?
not it. That's not it.
You did not, you are wrong. You didn't get it. Oh, God.
I mean, these gifts are waiting for people to just pick up.
The gifts are waiting. No, it was not correct. 0700 93 93 93 is the number to call. Let's see. Hello. Ha. Okay. What is going on? 0700 93 93 93 is the number to call. 0700 93 93 93. That is the number to call. Or you can call us on 0916 067 2362. We need to get at least one winner today. I mean, what's going on? Hello?
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 I can hear you. Good morning.
Good morning. What's your name and where are you calling from?
My name is Vera. I'm calling from Ikorodu.
Vera from Ikorodu. All right, Vera, quickly. Are you ready for a question?
Yeah, Vera, can you mention 2 hygiene practices to put in place in a work environment?
Okay, walk around as the employee, as the employee. You walk sit for a long time. You try and walk around.
Mm-hmm.
Then you drink adequate water at intervals.
Okay.
Yes.
While you did not answer the question specifically, I think it just demonstrates that you've been listening. Actually, those are measures that employees can do, things that can be put in place to encourage healthy.
So you are giving it to her?
Yes.
Congratulations, Vera. Vera, please send your name and number to our WhatsApp platform right now. We gotta go. Final words.
Okay, thank you all for listening. It's been an interesting time on radio. We encourage all of you to follow our social media channels. Mm-hmm. We are on Twitter, Instagram, and Facebook. Our username is Adrasa Trust for educational conversation about our health. Thank you.
Thank you so much. All right, so they'll be back next week, Wednesday. Stick with us. Don't go anywhere. At the top of the hour, it'll be time for the world news. And after that, it'll be time for Sports Waka with Bode Bruno. And at 12:30, we make a return on the Media Rewind. Do not go anywhere.